hematological changes in pregnancy. Most of the time there will be one SBA on this particular hematological changes in pregnancy. What happens to the blood volume? There is a marked increase in the blood volume, which begins as early as 6 weeks. It peaks around 30 to 32 weeks of gestation and increases around 40 to 50% above the non-pregnant level. It remains almost constant till the term. So these all you should remember. Okay, there is a marked increase in the blood volume. When does it begin? As early as 6 weeks. Peak is around 30 to 32 weeks of gestation. We are talking about the blood volume, not the plasma volume. Okay, so early pregnancy around 6 weeks, it will begin. 30 to 32 weeks, it will peak. There is a total increase of 40 to 50% above the non-pregnant level. It remains almost constant till the term. Okay, and this is due to the increased uteroplacental circulation, increased metabolic demands. So all blood components increase, but they increase disproportionately. Okay, so that also we will see subsequently how much is the plasma volume and how much is the red cell mass that increases. The blood as such will have two components. So there is a disproportionate increase of the different blood components. Now let us see about the plasma volume. Okay, so plasma volume also starts increasing as early as 6 weeks. The peak is around 30 weeks. Okay, the increase is around 50%. Okay, here it was 40 to 50% above the, here plasma volume is around 50%. The absolute increase in the plasma volume is by around 1.25 liters. Okay, so whatever is the normal plasma volume, in that you will have addition of 1.25. Okay, so factors increasing the plasma volume. One is a multigravid status, then multiple pregnancies, large fetus, they will have the additional increase in the plasma volume. Then we will talk about the RBC mass. Okay, so the blood has got two components, plasma volume and the RBC mass. The RBC mass and the hemoglobin. So the RBC mass increases by around 20 to 30%. Total increase is around 350 ml. It begins as early as 10 weeks of gestation. Okay, so RBC mass will start increasing by around 10 weeks of gestation. It will continue till term. There is no plateau here. Okay. Then additional changes, what you see, there is an increase in the retic count around 2%. Then increase erythropoietin and iron supplementation further increases the RBC mass. Okay. So these changes you should remember what we have discussed. So this is the same thing is mentioned here in the tabular form, which you can grasp easily. Okay. So blood volume in non-pregnant status is around 4,000 ml. That will become 5,500 ml. So there is a 30 to 40% increase. These percentages you remember because they'll give you less than 10%, 10 to 20%, 20 to 30. So blood volume increases around increase in 30 to 40%. Plasma volume normally non-pregnant status 2.5 liters. That will become 3,750 ml. That is 1.25 liters will be added. So increases around 40 to 50%. RBC mass increase by around 20 to 30%. This all you should remember. Okay. So RBC mass volume is around 1400 ml. That will become, there is a 350 ml addition. Okay. So 1750 ml, 20 to 30%. Total hemoglobin is around 475 grams. That will become 560 grams. There is an increase by 18 to 20%. This figure also you should remember. Okay. Then hematocrit, there is a decrease in the hematocrit. Normally hematocrit is 38%. That will drop down to 32%. Okay. Then there is a concept of physiological anemia, and this is mainly because of the hemodilution. So what happens during pregnancy? There is increase in the plasma volume more than the RBC increase. Okay, plasma volume increases more disproportionately more than the increased RBC mass. That results in the decrease in the hematocrit, decreased hemoglobin concentration, around 2 gram fall at term is noted, and RBC count will be reduced by around 15 to 20%. Okay, what is the advantage of this hemodilution? There is a decrease in the blood viscosity, so better maternal oxygen fetal exchange. There is a decreased oxygen affinity, improves oxygen delivery. Then it protects against the postural changes such as supine or erect position, whatever the changes are happening. So it will protect against those changes, and blood loss during the delivery also, this hemodilution helps. Okay. Now we'll talk about the leukocytes and the immunity. What happens to the leukocyte count? Neutrophilic leukocytosis is seen during the pregnancy. Around 8,000 mm cube is the neutrophil count, which will be increased during pregnancy to 20,000 um, per cubic millimeter in labor. Okay. So normally around 8,000 millimeter cube is there. So it will increase to 20,000 per cube. Okay. Then cause is increased estrogen and increased cortisol level. There are certain immunological changes. There is a shift. This also you should remember. There is a immunological shift from the cell-mediated immunity to the humoral and innate immunity. Okay, so there is a decreased cell-mediated immunity and increased innate and humoral immunity. Okay, what happens to the plasma protein changes in pregnancy? Total proteins are increased, but there is a decrease in the concentration due to the dilution. Okay, so total proteins normally it is 180 gram, that will become 230 gram. So there is an increase in the total protein. However, protein concentration will reduce. So total protein 7 gram percent will reduce to 6 gram percent. Normally, this albumin level is 4.3 gram. It will reduce to 3 gram, while globulin, which is 2.7 gram, will increase to 3 gram percent. So albumin level is decreased by 30% and globulin level is increased by 30%. And most importantly, you should remember what happens to the albumin to globulin ratio. Normally in non-pregnant status, the albumin to globulin ratio is 1.7:1, which becomes 1:1. So there is a decrease in the albumin to globulin ratio. So 1:1 you should remember. So 3 grams is the albumin, 3 grams is the globulin. However, globulin is increased and albumin is decreased by around 30%. Okay. So what is the clinical effect of all these changes in the proteins? There is a decreased colloid osmotic pressure. There is a decreased blood viscosity that contributes to the edema formation. Okay. Now, blood coagulation changes. Normally, we know well that the pregnancy is a hypercoagulable state. So, which are the factors which are increased, which are the factors which are decreased, and the factors which remain constant, either unchanged or slightly increased. So, factors such as fibrinogen is increased by 50%. Other factors 1, 7, 8, 9, and 10. So these factors, so 7, 8, 9, 10, and 1, they will be increased. Okay, fibrinogen will also be increased. Then factor which is slightly increased or unchanged, 2, 5, and 12. Okay, 2, 5, and 12, they will be either slight increase or unchanged. The factors which are decreased are the 11 and 13. Okay, 11 and 13 will be reduced. So remember, whatever is increasing is except 2, there is an increase. So below 10, up to 10, the factors are increased, except factor 2. Factor 2 remains unchanged. Even factor 5 also remains unchanged. Okay. So below 10, 2 and 5, then 12 is also remaining unchanged. What is increased is 11 and 13. Okay. So 11, 13 is increased, 12 remains unchanged. Okay. So other changes, there is a fibrinolysis which is decreased till 15 minutes postpartum. The clotting time remains unchanged. Okay. So this table shows the coagulation profile. What happens to the platelets? There is a slight decrease. Okay. So slight decrease, you see the thrombocytopenia. Normally around 1.6 to 2 lakh per cube. That will be slightly reduced. Up to 15% reduction is seen. That is the dilutional thrombocytopenia you get. Then fibrinogen level, which is around 200 to 400 milligram per deciliter in pregnancy, will become 300 to 600 milligram per deciliter, almost 50% increase in the fibrinogen level. Fibrinolysis is normal, while here it is decrease in the pregnancy. Clotting time will remain normal and will be unchanged in the pregnancy. ESR will be increased. Okay, normally the ESR is around 10 millimeters per hour. It will increase to 40 millimeter per hour. So there is a 4 times increase in the ESR. So platelets may remain normal, or there is a decrease in the platelets by around 15%. This condition is called as gestational thrombocytopenia. ESR, we have seen there is a 4 times increase in the ESR. So there is a significantly increase in the ESR. This is mainly because of the increased fibrinogen plus globulin level. Okay. So, but that is why ESR is not reliable diagnostic marker in the pregnancy. Okay. So significance of hypercoagulable state. So why this hypercoagulable state is important during the pregnancy? Because it prevents the excessive bleeding during the placental separation. However, there is a risk of increased thromboembolism. Okay. We know that this hypercoagulable state will promote the formation of thrombi and emboli. So increased thromboembolism risk, but it will prevent against the excessive bleeding during the placental separation. So postpartum, what happens? All these condition factors will come back to the normal. So coagulation factors will normalize by around 2 weeks. The leukocyte will normalize by around 1 to 12 weeks. Okay. So just look at the summary, what we have seen in the hematological changes. Blood volume increases by around 40 to 50%. Plasma increases more than the RBC. RBC mass increases by around 20 to 30%. Hemoglobin concentration, there is a decrease hemoglobin, that is a hemodilution. WBC also shows increase, that is the neutrophilia. Protein levels are reduced, and coagulation, it is a hypercoagulable state.